Hello, my name is D.Brown. I'm a nursing student at Regis College, and I'm doing a short presentation on preconception effects of radon toxicity on women. First of all, what is radon? The Environmental Protection Agency reports that radon is a naturally occurring gas that comes from the decay of radium, uranium, and thorium. It is naturally found in rocks, soil, and groundwater. It is a single atom element, and it can easily go through walls, slabs, cavities in your home's insulation, coming from the ground up, your drinking water. It can get into wells and things like that. The most dangerous form is radon 222. It is the kind that causes cellular damage in our respiratory system. It is a natural occurring phenomenon, and it is really everywhere. It is most concentrated in the United States, in the states of North Dakota and Iowa. Since it is naturally occurring, it is everywhere, so everyone throughout the world could possibly be exposed to a small degree. The methods for it entering the body are inhalation and ingestion. It causes an increased risk of lung cancer, and it is most dangerous when the radon 222 breaks down and has daughters that go out into the environment and cause problems with patients. When you're researching a patient's potential exposure to radon, as in pregnant women, if you were doing a pre-pregnancy evaluation and training, some of the important things may be their occupational history. Have they ever been a miner, an excavator, or a builder? Do they live with someone who is? Do they live in an area where any of those things are happening? What year was their home built? Is it older? Does it have potential cracks in the foundation, the walls, and other areas that would make it higher risk? Do they have a family history of lung cancer already? Any compromised lung situations that may be exacerbated by potential radon exposure? What types of gas appliances they may have in their home? Do they spend very much time in poorly ventilated places, such as basements in their home? The less ventilation an area has, the more concentrated the radon can be. Also, smoke and exposure to secondhand smoke can also be a contributing factor to radon exacerbating an already bad situation in a pregnant person. Since it targets the lungs, a physical assessment would focus on things like shortness of breath, wheezing, hemoptysis, cough, chest pain, any recent weight loss, any weight loss over time that is unaccounted for or unintentional. There's no specific test for radon in particular. What you can do is test your home. There's kits, there's companies, there's lots of different avenues that someone could go to have their home tested. If you were suspected to have radon toxicity, a chest x-ray, a CT scan, and a sputum cytology would be some tests that could help identify if that was a contributing factor. The treatment is avoidance, number one. Well-lit, well-ventilated places. Minimize the threat to your home by adding fans, ventilation, fresh air, open your doors, open your windows. But with that being said, open windows and doors. Once they have been closed for 12 hours, radon begins to rise again. So what do we know about the effects of radon on a woman or her potential future fetus? There's not a lot of literature. There are some suggestions by the toxicology profile for radon at the Agency for Toxic Substances and Disease Registry that there's no reproductive effects in humans that have been attributed directly to radon. There is just limited information at this time. The National Academy of Sciences report that there is just not enough conclusive evidence to support any adverse effects on a woman who is trying to become pregnant or who is pregnant. One article I was able to find in the National Centers for Health by Langos, Lee, Lupo, Raybar, and Cortez said that there are very limited studies, and one that they conducted in Texas on 500 children that had birth defects and women that lived there found that there is a potential association to an increased risk of a cleft lip without a palate, lymphohemangioma, brain abnormalities, skeletal defects, and anomalies of the bladder and urethra. So you would certainly want to have yourself evaluated to make sure that you are not in that situation where you are in a toxic environment and need to be cleared of it. The Radon Lifetime Remediation Company suggests that it does have a higher effect on embryos due to their rapidly dividing cells, but that they are not a medical provider, but they do offer remediation services and a lot of information for remediation services within your home, which are included in this presentation. Again, preconception planning, meet with your GYN to discuss your particular risks, your hazards where you live, your occupation. Have your home tested, especially if you live in North Dakota or Iowa. Avoid exposure. If you do have a positive test in your home, you'll want to use a mitigation service to minimize the threats. Things like sealing up cracks, insulating piping, things like that can decrease the radon levels in your home. And again, opening doors. The best plan is to avoid exposure when at all possible. Some differential diagnoses that may be included in women that have radon toxicity and increased chance of lung cancer are lung cancer, bronchitis, pneumonia, leukemias, fatigue, weakness, things like that are going to be things that you look for in your physical exam. There is additional information that are available for anyone planning to become pregnant at the National Radon Action Level for American Lung Association. There's also a hotline for radon, a safe drinking water hotline, and the CDC also offers information, and they have their contact numbers included in this presentation for everyone to view. I have multiple references, including the World Health Organization, different studying partners included in the North American Residential Society, some different avenues that everyone could check out. I will be attaching this. I hope that you enjoy it. Thank you.